Hello, and thanks for joining us again this week. We are on episode 9 in our pregnancy series on our Impact Your Life channel, and we are still uploading every week topics relevant to pregnant and postpartum women. Today we are talking everything about lower legs and feet. My name is Christie Amundson. I am 28 weeks pregnant this week, so yay for the third trimester. And I'm going to be going over swelling, cramping, and pain in the lower legs, why that happens in pregnancy, what's normal, what's not normal, and some things that you can do to help manage those things. So, swelling we're going to start with. Why do we get swelling? Our amount of fluid in our bodies when we're pregnant increases drastically. So the total body water volume actually increases up to 8 liters. And within that, our blood volume increases on average about 45%, but it can range from 20 to 100% of your pre-pregnancy levels. Where is all that water going? Well, some of it is staying in your cells, but most of it is actually accumulating outside of your cells, helping with things like enhancing oxygen delivery and clearing waste out and controlling your electrolyte flow. And then within your blood, all that extra blood is supplying the placenta and also supplying your organs to help manage and supply your growing fetus. So the main reason that it's common and actually quite normal to have some swelling during pregnancy, especially in the later months of pregnancy, is exactly for that reason, is we have all this extra fluid and it kind of has nowhere else to go. So how do you know it's normal? Normally, we should have, or we would expect to have some swelling after you've been standing or being active for a long period of time. Again, we tend to see this later on in the pregnancy, so for sure, usually after about 20 weeks, but typically it happens more later in the pregnancy, third trimester. So after standing or being active for a long period of time, also if you in the summer, or if you live in a climate that's very hot and humid, we tend to see more swelling in those months or in those areas. And then also if you have excessive amounts of sodium intake or caffeine intake. So that can be almost a day-to-day thing. So if you had some kind of meal that was really high in sodium, a lot of processed foods, or happen to have a lot more caffeine than usual, you may see an increase in swelling related to that. Or if you're someone who just has a diet in general that is higher in sodium or higher in caffeine, you may have more issues with swelling because of that. So what is not normal? So the two things that they're most concerned about with swelling in pregnancy are going to be signs of preeclampsia and blood clots. So preeclampsia, what you're going to be wanting to watch for with that is if you're swelling, if you get a lot of swelling in your face or really puffiness around your eyes, if you have a persistent headache along with the swelling, if you have a really sudden and drastic weight gain, if you have abdominal pain along with the swelling, or if you have any vision changes. So those are kind of the high, and then if you have the ability to take your blood pressure would be very high. So if you have any of those symptoms, you should definitely call your provider that's managing your pregnancy. The signs of a blood clot, usually we would see blood clots in the lower legs. And one of the main things you're looking for is if one leg is much more swollen than the other, so kind of an unevenness. You would also have a much more significant pain and tenderness on that side. You'll have redness on that side and warmth. So sometimes it's hard to check warmth on your own because a lot of us feel hot all the time. So it's helpful to have maybe somebody else, if they were to touch your legs on both sides at the same spot, the affected side would be much warmer than the non-affected side. So if you have any of those symptoms, or if you're just not sure that your amount of swelling is normal, always just call your provider. It never hurts, because although both preeclampsia and blood clots are relatively rare in pregnancy, they do occur, and blood clots do occur quite more often in pregnancy than without pregnancy. So I would definitely say check in if there's any, questions about that. When it comes to cramping, a lot of times when we get cramping, it's more in the lower legs and the feet, oftentimes at night. And it is a lot more common in pregnancy, although there's no exact cause of this. It's still kind of unknown. There's theories about the imbalance of electrolytes, that when you have so much of an increase in fluid, and there's also theories about circulation issues. But there's nothing that has come out, no research that has come out to really with a definite cause of it. What we do know is also that you get a lot of foot pain, or you can get a lot of foot pain with pregnancy, and the foot pain is more related to when your placenta releases the extra hormones, especially that relaxin hormone. It causes the ligaments throughout your body to kind of relax and loosen. And when the ligaments and muscles in your feet can relax, if you're someone who, like most of us, stand and walk quite a lot, that can stretch and put more excessive pressure on both the joints in your foot, the fascia along the bottom of your foot, your plantar fascia, and also the muscles in your feet. So this can cause a lot of pain and instability in the foot. So we have all this going on with pregnancy, but what can we do about it? That's the real question, right? Let's talk about that right now. All right, so what can we do about all this? So first of all, to manage the swelling, there's lots of things you can do. So over and above anything, trying to rest when you can. And obviously when you're resting, trying to lie down whenever you can on your side, not on your back. You want to avoid prolonged sitting or standing or anywhere where your legs are in a real dependent position. If you can, elevate whenever possible. So it's best if you're elevating your legs. You probably heard of the term, elevate above your heart. That's to help the blood flow. Obviously the blood is trying to get back to your heart to return. But also that extracellular fluid that we were talking about earlier, that's kind of accumulating, that actually needs to get to your groin to be reabsorbed. So even if you have like a desk job and you don't have the ability to lie down all the way on your back while you're working, just propping your feet up on, a stool or a chair or something like that, still can be a little bit, as long as maybe they're at just even a tiny bit of a downhill slope to get to your groin, that can help manage that swelling. The other thing is, one of the most important things you can do is drink a lot of water, especially if you're someone who has this higher sodium intake or caffeine intake. Caffeine dehydrates you, and sodium also, if you have a high sodium content in your diet or in your body, it will cause you to retain fluid. So there needs to be an equal balance of water and sodium in your body for your body to work right. So when you're high on sodium, it's going to hold on to water. Whereas if you drink more water, it sounds kind of almost oxymoronic, like why would I drink more fluid if I already have a lot of swelling? But it actually does really help with the swelling, because it causes your body to say, okay, I can actually let go of some of this now. If you are in a really hot climate or during the summer months, try to limit your time outside in a really hot, humid environment. And you also want to wear relatively comfortable, supportive shoes. So we'll be talking a little bit more about that in a minute. The salt and caffeine intake, like we talked about earlier, trying to decrease that or monitor that a little bit more. And then the other thing is trying to increase your potassium intake in your diet. So eating things like bananas get all the press for potassium, but other foods that are high in potassium are like coconut water, avocados, baked potatoes. Like the skin of a baked potato has a lot more potassium actually than a banana does, but bananas get all the press. So you're also going to avoid wearing tight things around, if you're swelling in your hands, you want to avoid wearing tight things around your wrists or your fingers, like rings or watches that potentially will limit some of that fluid to get back. And same thing with your ankles. If you wear ankle bracelets or anything like that, trying to avoid anything that's tight enough that kind of leaves a little bit of a divot in your skin or wrist or ankle. And then some exercises that you can do to help kind of return the blood. Pretty simple. It's called an ankle pump. So you can do this in any position. Obviously, if you're lying down with your feet up above your heart, that's the best. But in literally any position, if your feet are out, all you have to do is pull your toes back toward your face, hold for a few seconds, and then push them away from you and hold a few seconds. You do want to pull all the way, hold for a few seconds, push all the way down, hold for a few seconds. You don't want to just quiver your feet back and forth like this, because what we're trying to do is use the muscles of your lower leg to help pump some of the swelling back up. So you really want a good contraction both directions. You can also do this if you don't have the ability to put your feet up, literally doing it in a sitting position where you push down, hold for a few seconds, and pull up, hold for a few seconds, push down. So it's not rocket science, but it's something that if you're kind of stuck in a position and you don't have the ability to move around a lot, to be doing this. It's actually better if I'm sitting at a desk, if I have the ability to get up and actually walk around where your leg muscles, your whole leg muscles have to work. That's the better option, but not all of us have that option always. So, and then the last thing too that can be really helpful is compression stockings. So you can get compression stockings that come up to your knee, and then there's ones that come actually all the way up to your groin, depending on the level of and degree of your swelling. You can get them online if you just search compression stockings. You can say like knee-high compression stockings or thigh-high compression stockings, depending on kind of what you're looking for. There are different levels of compression, so I would recommend if you're not, if you're just trying them out, I would try mild compression first. But if you're thinking that you might want to go above mild, then I would talk to your medical provider and make sure and see if they have a recommendation based on the level of your swelling, what kind of compression that you should be kind of seeking out for. So for cramping, it's actually kind of a lot of the same kind of recommendations. So cramping has been linked to water intake, so trying to stay hydrated will benefit for the cramping as well. Also, it's been linked to potassium and magnesium intake, so making sure that your dietary potassium and magnesium levels are good. If you're going to try to take supplements of any of that, I would check with your provider again, because sometimes depending on your medications and other complications, you want to make sure individually that that's appropriate for you. But trying to get what you can from your diet is always the best route to go, and it also is the best absorbed that way. Also, if you're having a cramp, like at night and your lower leg is cramping up in your calf, the best thing you can do is straighten out your knee fully and pull your toe all the way back. Basically, that just stretches the muscle out that happens to be cramping and puts it in a little bit better position to help release the cramp. You can also do this as just a stretch throughout the day, straightening your knee, pulling your toe back, and you should be able to feel a stretch in the back of your thigh, or in the back of your calf here. And then also, you could try just doing, generally speaking, kind of a gentle stretching routine before bed. I actually go over a good pregnancy stretching routine in episode 8 of the series, so check that out. My favorite calf stretch is actually if you have any kind of, like this is just a phone book, if they exist anymore, but any kind of a book or piece of wood. And if you were to stand, you would definitely want to wear shoes, and you're going to put the kind of the ball of your foot or the front of your foot on the book, and your heel would stay flat on the ground. Your knee would straighten, and then you're going to step your other foot forward. So it just looks like this, and you should feel a stretch in your calf. Now, you should be able to stand here and feel a good stretch without having to step way far forward. So if you can't, then you would want to use a thicker book when you do it. Your calf can be a relatively stubborn muscle to stretch, so it's more effective if you can hold this stretch for a little bit longer. As long as you're feeling the stretch in your calf or down in the tendon down here and not in the bottom of your foot. So that's partly why you would want to wear good shoes when you do this stretch. But I want you to hold this stretch for usually at least 2 or 3 minutes, as opposed to kind of a typical 30 to 60 second hold. Then you would flip to the other side. And again, you would not do both sides at the same time. But you might notice that one side might be tighter than the other, and you might need a bigger book on one side, a smaller book on the other. I like this stretch because it's very functional. So it's easy to do. So you could throw the book down while you're brushing your teeth or getting ready in the morning or at night. And it's just an easy thing to work into your day, as opposed to some of the other options where you're leaning up against a wall or something like that, where it's just more taxing on your system. So now we're going to talk about shoes. So what we talked about with your feet, one of the most important thing when it comes to foot pain is making sure your foot is well supported. So that means a really good shoe. And sometimes that means wearing your shoe more often than you would normally. So for example, wearing it in the house at night when you get home, or having maybe a separate pair of shoes that you wear in the house. You can find some slippers and things that have some good arch support in them. You just have to kind of look around. I'm going to show you kind of what I look for in a good shoe. And to be honest, this is not pregnancy specific. This is anyone specific. So when you're looking at any shoe, what you're going to look at is, first of all, you want a really good heel. So you want something that actually has a heel, so not like a slip-on shoe. But you want the heel to come all the way up above your heel bone, first of all. So it should be pretty high. And then it should be pretty firm. So if I tried to squeeze this down, you notice it doesn't really bend. So I stole a shoe from one of our staff members to show you kind of the example of what a not so good shoe would be. So if I push this, do you see how that kind of squishes down? Or some of them will fold inward. Sometimes this happens actually a lot. We see this a lot in kids who sometimes are too lazy to tie their shoes, but they'll jam their foot in the shoe so much that maybe it used to be firm here, but it will fold the back of the shoe down, and it actually does ruin the shoe. So you can tell your kids that. And then you want to make sure if you push on both sides of the heel, that one side does not give more than the other. So I shouldn't be able to squish down one side more than the other. We typically will sometimes see that in shoes that where the outside gives a lot more than the inside. So you do not want that. So if I do this to this shoe, it just bends right down. So you can see how that's not what we would want. And then generally, also when you're walking in it, so if you were to try on a shoe, if you're walking in it, you want to be able to kind of sense your heel hitting the ground when you walk. And so you would want to be able to sense your heel, and you want to sense your arch. So the inside of your foot, arch. And then you also want to be able to sense your big toe when you push off. So those three things when you're walking around, so if you try on a pair of shoes at the shoe store and you're walking around in the store, you want to be able to sense heel, arch, which is this arch on the inside of your foot, and then your big toe on any shoe that you're trying on. The other thing is it should be comfortable. You should not have to break shoes in. So it should never be like, well, Christy said this was a good shoe, and it's not that comfortable to me, but I'm going to try it and hopefully I'll break it in when I get home. It should always be comfortable enough for you that you don't have to break it in. And then the last thing I look for is this middle part of the shoe, so the arch. When you put the shoe on, you want that arch to be enough that it really feels like it's supporting your foot, not shoving you up so far that you kind of turn to the outsides of your feet, but supporting your arch so that when you walk, you can feel your arch when you walk. And a good way to test for that too is making sure that the shoe does not bend through this arch. Because if the shoe bends through that arch, that means every time I take a step, and I push off, my whole body weight is gonna really flex through this arch, and that's not gonna feel good over time. So if you take the shoe and you try to bend it in half, and remember, you can push pretty hard because it's your whole body weight that's gonna go through the shoe. So when I push hard on this shoe, it only bends, as you can tell, in the toe box, and that's what we want. We do not want the shoe to bend through the center of where the arch is. The other thing you could try is if you take the bottom and you try to wring it out like a towel. Again, the front of the foot the front of the shoe should twist, maybe a little bit in the back, but it really should not twist through this middle part. So if I do that with this shoe, you can see how that kind of bends that shoe in half. So again, every time this person takes a step and pushes off, instead of having a stable foot and being able to push off through their big toe, they're gonna bend right through that arch. Same thing if I try to, twist the shoe, it just twists right in half through that middle where we don't want it to bend. So you can go to any shoe store and kind of do these tests. Try to bend it this way. Try to push on the heel. Make sure it's firm. Also, if you put the shoe on a table, my hands aren't really doing it justice, but it should not look like if you put a brand new shoe on the table, like it's kind of like, looks like this. It's canted one direction or the other. So look for that as well. A couple shoe manufacturers have started to cant their shoes in one direction, which we definitely don't want. A lot of times if you've been wearing a shoe for a long time, you will see if you put it on the table, you'll see the wear on it will make it look kind of canted to the side. So super important in general to be in supportive footwear as much as you possibly can, especially when you're pregnant, and then to wear it probably more often than you normally would. So if you usually can get away with wearing a lot of flip-flops or kind of minimalistic shoe wear, sometimes in pregnancy that goes away a little bit just because of our laxity. So you'll have to be a little bit more careful. I would say of all of this, the most important thing is making sure that arch is supported, because again, if that arch isn't supported, the ligament laxity that you're gonna feel along with your weight gain and body weight just in general is gonna really put a lot of pressure both on the joints and along the bottom of that plantar fascia, which can be no fun for anybody. So thank you so much for watching, and please, if any of this stuff that you found helpful, subscribe to the channel and give us a thumbs up, and we will see you next week. Take care.